Hello all. Today we are going to discuss about the topic positions. I am Mrs. Golden, working as tutor in MMM College of Nursing. Objectives: at the end of the class we will be able to see about introduction to positions, what is positioning, what are the purposes of positions, what are the principles involved in patient positioning, what are the types of positions, what are the indication for each type of position, and conclusion. Introduction: therapeutic positions are used to provide comfort to the client. Proper turning and position of the client allows the healthcare provider to make the client as comfortable as possible to prevent contractures and pressure sores. Proper position helps in diagnostic tests or surgical intervention and procedure and allows the clients for greater access to the environment. Definition: position is defined as planning the person in a proper body alignment for the purpose of preventive, promotive, curative, and rehabilitative aspects of health, or placing the patient in a good body alignment as needed therapeutically. Purposes: to promote comfort to the patient, to relieve pressure on the pressure points, to stimulate circulation, to carry out nursing interventions, to perform surgical and medical interventions. Principles: to maintain good body mechanics, we must wash hands before and after the procedure. We must ensure patient's comfort. We must obtain assistance as required. Follow all the safety measures to prevent the accidents. To follow all the systematic and orderly way of positioning the patient. Use the right technique at the right time. Types of positions: supine position, prone position, lateral position, lithotomy position, Fowler's position, semi-Fowler's position, Sims position, Trendelenburg position, knee chest position, orthopneic position. Supine position: the patient lies on his back with his head and his shoulders are slightly elevated. So what are the indications in supine position is? It is a usual position of the client to examine the chest and the abdomen. So this is the supine position. Prone position: position in which the patient lies on the abdomen with the head turned to one side with a small pillow under the ankles for the support. Indications for this position: to do any renal biopsy, to examine the back. For patients after 24 hours of amputation of the lower limbs, the patient will be placed in the prone position. This is the picture for the prone position. Lateral position: the client lies on one side with weight on a hip and a shoulder, or the patient lies on the side with both arms forward and his knees and hips are flexed. The upper leg is flexed more than the lower leg. The upper knee and the hip should be at the same level. A pillow should be given under the head, back, and front to support the arms and the abdomen. A small pillow is placed in between both the knees. Indications for this position: it is used for any examination of perineum, to insert suppositories, for giving any back care, to give enema and colonic irrigation. This position can be used. This is a picture for lateral or side lying position. Lithotomy position: the client lies in the supine position, that is the back. The patient lies on the back with hips flexed, the legs are separated and thighs are flexed. The patient buttocks are kept at the edge of the table and the legs are supported for the stirrups. Indications: this position is mainly used for the delivery of baby, to do any rectal examination and surgeries, for vaginal examination and hysterectomy. Lithotomy position: Next, we are going to discuss about is Fowler's position. It is a sitting position in which the head is elevated to about 45 to 60 degree and the client knees are slightly elevated to avoid the pressure on the popliteal vessels. Backrest and two pillows are used for support at the back and the head. Pillows can be used to maintain natural alignment of the hands, wrist and forearms. Indications: to relieve dyspnea, to improve the circulation, to relax the muscles of the abdomen, back and thighs, to relieve tension on abdominal stature. This is Fowler's position. Sims position. In this position, the client lies on either the right or the left side. The lower arm behind the body and the upper arm is bent at the shoulder and elbow. Both the knees are bent with the uppermost leg more acutely bent. This position is similar to the lateral position, except is that the patient weight is on the anterior aspect of the patient's shoulder, girdle and the hip. Indication for this position: to perform vaginal and rectal examination, for the administration of enema and suppositories, used for the relaxation of the antenatal exercises, position for sigmoidoscopy and proctoscopy. This is Sims position. Trendelenburg position. In this, patient lies on the back with the head is lower and the foot of the bed is elevated to the 45-degree angle. Entire frame of the bed is tilted with the head of bed down. Indications for this position: used in emergency situations like shock, hemorrhage and hypotension, for the postural drainage, patients with deep vein thrombosis. This is Trendelenburg position. Knee chest position. The patient rests on the knees and chest. The body is at the 90-degree angle to the hips with back straight, the arm above the head and the head turned to one side. The abdomen remains unsupported. Indications for this position: used for vaginal and rectal examination, used for any first aid treatment in cord prolapse or retroverted uterus, as exercise for postpartum and gynecology patients. This is the picture for knee and chest position. Next one is orthopneic position. Fowler's position with over cardiac table to be placed across the front of the patient. Patient to rest both the arms on the cardiac table or on the pillow placed in it and lean forward. Leaning forward facilitates the respiration process by allowing maximum chest expansion by reducing the pressure of the abdominal organs and the diaphragm. Indication for this position: patients with severe dyspnea, cardiac patients, position for thoracentesis, patient with chest drainage tubes. Conclusion: patient positioning involves properly maintaining a patient's neutral body alignment by preventing hyperextension and extreme lateral rotation to prevent complications of immobility and injury. Positioning the patient is an essential aspect of nursing practice and the responsibility for a registered nurse. Thank you.